In this video, we will look at the top 15 human diseases of all time. These conditions have affected millions throughout history, from ancient plagues to modern epidemics. We'll discuss each disease in detail, including their symptoms, causes, and treatments. So if you're interested in learning more about the most significant health challenges humanity has faced, then keep watching. Starting off our list at number 15 is influenza. This highly contagious respiratory illness is caused by influenza viruses, which can be spread through the air or by contact with contaminated surfaces. Symptoms of the flu can include fever, cough, sore throat, body aches, and fatigue. While most people recover from the flu without complications, it can be deadly for the elderly, young children, and people with weakened immune systems. Treatment for the flu typically involves rest, fluids, and over-the-counter medications to relieve symptoms. Vaccines are also available to prevent influenza. At number 14, we have tuberculosis. This bacterial infection primarily affects the lungs but can also spread to other body parts. Symptoms of tuberculosis can include cough, fever, night sweats, and weight loss. In some cases, tuberculosis can be latent, meaning the person has no symptoms and the bacteria are inactive. Treatment for tuberculosis involves a combination of antibiotics over a period of several months. Coming in at number 13 is polio. This viral infection can cause paralysis, muscle weakness, and respiratory failure. The poliovirus is spread through contaminated food or water, primarily affecting young children. While vaccines have greatly reduced the incidence of polio, the disease remains endemic in some countries. At number 12, we have malaria. This parasitic infection is transmitted through the bites of infected mosquitoes, and can cause fever, chills, and flu-like symptoms. Malaria is a major public health problem in many tropical and subtropical regions, particularly in sub-Saharan Africa. Treatment for malaria typically involves a combination of antimalarial drugs. At number 11, we have cholera. This bacterial infection can cause severe diarrhea and dehydration, and is spread through contaminated food or water. Cholera is a major public health problem in many developing countries, particularly during poor sanitation or disaster. Treatment for cholera involves rehydration and antibiotics. Moving on to number 10, we have syphilis. This sexually transmitted infection is caused by the bacterium Treponema pallidum and can cause a wide range of symptoms, including sores, rashes, and fever. If left untreated, syphilis can lead to serious complications, including damage to the brain, heart, and other organs. Treatment for syphilis typically involves antibiotics. At number 9, we have smallpox. This viral infection can cause fever, rash, and scarring and has been responsible for major epidemics throughout history. The smallpox vaccine was developed in the late 18th century and eradicated the disease by 1980. Coming in at number 8 is HIV/AIDS. This viral infection attacks the immune system and can lead to various symptoms, including fever, weight loss, and opportunistic infections. HIV is primarily transmitted through sexual contact, sharing of needles, or mother-to-child transmission during pregnancy, childbirth, or breastfeeding. While there is no cure for HIV/AIDS, antiretroviral therapy can help manage the virus and prevent transmission. At number 7, we have hepatitis B. This viral infection can cause liver inflammation and damage, and is spread through contact with infected blood or bodily fluids. Symptoms of hepatitis B can include fatigue, nausea, abdominal pain, and jaundice. While most people recover from hepatitis B without complications, some may develop chronic infection that can lead to liver cirrhosis or cancer. A vaccine is available for hepatitis B, and antiviral medications can be used to treat chronic infection. Number 6, we have Chagas disease. This parasitic infection is spread by insects known as kissing bugs and can cause fever, swelling, and heart or digestive problems. Chagas disease is a major public health problem in Latin America, where it is estimated to affect around 8 million people. Treatment for Chagas disease involves antiparasitic medications. At number 5, we have Ebola. This viral infection can cause fever, bleeding, and organ failure and is spread through contact with infected bodily fluids. The 2014 to 2016 Ebola outbreak in West Africa was one of the deadliest in history, killing over 11,000 people. Treatment for Ebola primarily involves supportive care, such as fluids and electrolytes and experimental antiviral medications. Coming in at number 4 is measles. This viral infection is highly contagious and can cause fever, rash, and respiratory symptoms. While most people recover from measles without complications, it can be serious or deadly for young children, pregnant women, and people with weakened immune systems. Vaccines are available to prevent measles. At number 3, we have diabetes. This metabolic disorder is characterized by high blood sugar levels and can lead to various complications, including heart disease, kidney failure, and blindness. Type 1 diabetes is caused by an autoimmune response that destroys insulin-producing cells in the pancreas. In contrast, type 2 diabetes is primarily caused by lifestyle factors such as obesity and lack of physical activity. Treatment for diabetes involves blood sugar monitoring, lifestyle changes, and medications such as insulin. Moving on to number 2, we have cancer. This group of diseases involves the uncontrolled growth and spread of abnormal cells and can affect any part of the body. Cancer is one of the leading causes of death worldwide, and can be caused by various factors, including genetics, lifestyle factors, and environmental exposures. Treatment for cancer may involve surgery, radiation therapy, chemotherapy, immunotherapy, or a combination of these. And finally, at number 1, we have cardiovascular disease. This group of conditions involves the heart and blood vessels, including coronary artery disease, heart failure, and stroke. Cardiovascular disease is the leading cause of death worldwide, and can be caused by factors such as high blood pressure, high cholesterol, smoking, and diabetes. Treatment for cardiovascular disease involves lifestyle changes such as a healthy diet, exercise, medications, and in some cases, surgery. And that's it for our top 15 human diseases of all time. These conditions have affected millions of people throughout history and continue to be major health challenges today. While many of these diseases can be prevented or managed through vaccinations, medications, and lifestyle changes, there is still much work to be done to fight against human illness. Thanks for watching and stay healthy.